Hi everyone, welcome to our channel. This is Sheelam Srujan, a final year medical student in GMG Siddipet. Here is Dr. Prathyush Raj sir, final year resident in our college in the Department of General Surgery. Hi sir.
Hi. Hello everyone.
Sir, so we got the schedule for our exams also.
Yes.
So in this 45 days, can we read surgery in the full blown so that we'll understand the subject and present it in the paper well? And how to start studying for surgery? Ee doubts maakunnai sir. Can you please speak on this?
Yeah, so right now like the schedule is out. I think you have somewhere around 60 days of time left to you. But effectively speaking, you will be having 45 days, and let's keep last 15 days for revision part. So if we consider 45 days, it's not only about the surgery now. Okay, you have to read other subjects as well, and based on your interest and the way you prepared for your internal examinations, you have to finish some part of the syllabus. So based on that, you need to make a proper schedule. So actually start working. So it was brought to my notice that like if somebody asked me, sir, can I start preparing for surgery if I did not start preparation at all? Like I did not touch the book at all.
Most of us are like that, sir.
It's not like that, but you might have learned something like by attending clinical posting or attending some classes. But I would like to tell finishing surgery in this span is it's difficult. Okay, so the first rule which applies is don't change the textbook right now.
Okay.
So whichever book you were following for the entire year, which you brought, and you read some part of it for some class preparation or seminar preparation or for the internal exams, I would strongly recommend you to follow the same textbook, irrespective of whether it's a standard textbook recommended by somebody or like some senior recommended a small subject or some other notes. At first, the priority should be not to change the material and try to use the same material, because change of books right now will be a disaster.
Okay.
Yes. Second thing, whatever you read, start revising it. Okay.
Yes.
Because in a process of studying, you should not forget also. So you should monetize on the things which you already know. So the second priority would be revising what you already read for the previous exams, which you already read. Third thing will be everyone has difficult places. Yes. So these difficult places needs to be recognized and they need to be given special attention.
Okay.
Just because you are afraid of a topic, it doesn't make it easier. Yeah, when you feel something is difficult, it needs more attention.
Okay.
So in surgery, there are areas which needs a little more time for understanding. So in these situations, you can approach some professor for easy explanation of the topic. Right now, like it's not recommended last minute to go to somebody, or finding some senior who could help you.
Yes.
Or some resident who can help you.
Yes.
Can really make the understanding better, rather than making it a place where you are studying everything by rote and trying to memorize it. You can have some logic behind or some concept understanding which can make things easier for you. Yes, and it will also avoid when you are facing a question in the exam, you are less likely to get confused.
Okay.
When you understand little about what is the disease process, what actually is happening in it, and how to approach, how to treat it, then you are less likely to make the mistake by getting confused with this disease with some other disease.
Yes, sir.
So to summarize, it's don't change the textbook.
Yes.
Yes. Second thing, revise what you already know.
Yes.
Yes. Third thing, identify the difficult areas where more attention is needed.
Okay.
Okay. When it comes to surgery, there are two papers, paper 1 and paper 2. Okay.
Yes.
So recognizing which paper you are comfortable with is firstly. So try to finish that paper in a better way. Recognize the areas where you are getting the questions, or the areas where potential questions can be asked, where essays are asked. This can be learnt very well from the last 10 years papers. Last 10 years paper is not a guarantee that you will answer everything, but it will give an idea how a paper will be prepared and what kind of questions are expected in the exam.
Okay.
So that can direct your preparation.
So we can pass by past 10 years papers now, sir.
I'm not saying like past 10 years papers. Yes, you can pass, but it will guide your preparation process.
Okay.
Past 10 year papers are guide to your preparation. It's not guide to your writing the exam and passing it.
Okay, sir.
Okay.
Yes.
So when you recognize that these are the important areas where questions are asked, you can put more attention to this topic rather than the rarely asked questions. Yes.
Yes.
Rarely asked questions, they need less importance when it's time of exam preparation, when I am left with only 45 days.
Yes.
Maybe like for surgery, I'm only left with 10 to 15 days only. Yeah, to finish 10 to 15 days, the areas where questions are asked are more important. So you can recognize, like if you are comfortable with paper 1, try to finish paper 1 soon, revise it, and then recognize the paper 2 difficult topics and concentrate on it. And paper 2, we also have orthopedics.
Yes, sir.
Okay, if you read orthopedics well in your previous papers, your exams, try to finish it soon in lesser number of days. Revise it, close it, and then start the difficult parts.
Okay.
So don't try to compare the topics, compare the subjects like this is more important, this is less important or anything. First, I recognize the areas which needs more attention and try to cover as much syllabus as possible. Okay, there is no guarantee that if I read only paper 1, if I read orthopedics, I will pass, I will get distinction or something. You need to have an entire idea. If you don't read now, it is again difficult later. And whatever you read now will again help you in the practical exam.
Yes, sir.
Yes. So right now, whatever book you start with, try to cover it. Okay. Past 10 years topics needs to be covered before exam. Okay. Upon that, you need to add other topics as well.
ఓకే సార్.
Okay.
సార్ సో చాలా మందికి ఉన్న డౌట్ ఏంటంటే ఒక క్వశ్చన్, టెక్స్ట్ బుక్స్ చదవకుండా మ్యారో వీడియోస్ కూడా చూడకుండా డైరెక్ట్గా మ్యారో నోట్స్ చదివితే సర్జరీ పాస్ అవ్వచ్చా అనేది క్వశ్చన్ ఉంది సార్. మీరేమంటారు?
Actually, Marrow notes or any Smahrt notes are not recommended for exam preparation as okay. These are all like things of a shortcut to exam preparation, where students gain confidence that they have covered more topics in less time and they can write well. Okay, but in no way it is a guarantee that you can pass the exam. Yes, and you can score more. If it was like beginning of the year or anything, I could have recommended like you need to go through a standard textbook or any other textbook. But as we are speaking about the last minute time, if you can cover more topics in less duration of time, such notes can be used. But such notes should also be used in complementary to the standard textbooks. Okay, something like there should be a standard textbook which is the base for your preparation, and it should be built on these notes. Okay, so that in less time you cover more topics and some points are actually added from the standard textbook.
Okay.
Because all these things are basically shortcuts to exam preparation. So these books are not ideally recommended, but in a smart way they can be used and they can be helpful in covering more topics, more syllabus in less duration and having better score.
Yes.
Okay, but in no way it is recommended, and no way it's a guarantee that you can pass exam with it.
Okay, sir.
Okay, there are other factors affecting it as well, no?
Okay.
So always, if there is a shortage of time, you can use such notes, but always have a base of standard textbook.
Yes.
Okay.
సార్ సో స్మార్ట్ నోట్స్ అని ఒకటి ఉంది సార్, అది రెడీమేడ్ వర్షన్ లాగా పాస్ట్ 10 years క్వశ్చన్స్ ఉంటాయి, పాయింట్ వైజ్ ఆన్సర్స్ ఉంటాయి సార్. చాలా మంది స్టూడెంట్స్ అదే చదివి వెళ్దామన్న ఆలోచనలో ఉంది సార్. దీని గురించి మీరు ఏమంటారు సార్?
Smart notes are again for smart work only. So in less duration, if you think you can finish your syllabus, you can do it. But the problem with such notes is you can always get confused with things. Because when you take a shortcut, you don't actually understand the subject and the concept.
Yes.
So you may get confused with the disease condition which is asked in the exam. Because these days, questions are coming in a case scenario.
Clinical
given
based.
a proper history and clinical findings, and you are asked to make the diagnosis and how will you manage the case.
Yes.
Okay. In such situations, these notes may not be useful. So I would say like if you have read some standard textbook in the past, and right now for exam in preparation, you don't have much time to revise it. Such notes could be really helpful in revising the concept well.
Okay. Yes.
For revision, and actually like what points have to be mandatorily written in the exam.
Yes.
Such things could be used using these notes in a better way. Okay, because we can very well understand that in standard textbooks it is given in a very lengthy way. So reading it once, it's a big task. But again, if you are revising it in front of the exam, few days before the exam, going through a standard textbook would be a hectic task. So if you already read the textbook, you understood what the concept is, these books can be really helpful for rapid revision.
Okay, sir.
Yeah.
So after understanding the concepts from textbooks, just for revision, we can go for smart
revision
notes.
We can use, but again, it is not recommended for 100% surgery preparation.
Okay, sir.
Okay, because it's again a very shortcut, and the shortcuts are like luck based. If you are lucky enough, you will score something, but there is always some risk to it.
Yes.
So the fail safe method where you can have a short thing is going through a textbook, but you should also consider like we are limited with the less time.
Yes, sir.
Okay, so the areas where like a high potential of a question being asked, it is better to refer the topic from the standard textbook.
Okay, sir.
Okay, when there is like a less important topic, or you think like it is not asked in the previous exams, it's a rare thing. Such things can be rapidly revised using these notes. Okay.
సార్, సో ఎగ్జామ్కి ముందు ఎలా ప్రిపేర్ అవ్వాలో, ఎలా అప్రోచ్ అవ్వాలి అనేది మనం ఇప్పుడు చూసాం కదా సార్. ఎగ్జామ్ హాల్కి వెళ్ళిన తర్వాత ఎగ్జామ్ ఆ 3 hour ఎగ్జామ్ మన మార్క్స్ డిసైడ్ చేస్తుంది. సో ఎలా ప్రజెంట్ చేయాలి, ఎలా ప్రజెంట్ చేస్తే కొన్ని ఎడ్జ్ మార్క్స్ ఎక్కువ ఎలా తెచ్చుకోవచ్చో చెప్పండి సార్.
So after finishing the preparation, no matter how much you read, presentation also matters. Okay, so trying to understand what examiner is actually expecting you to write, then actually presenting it in a way and examiner in a very simple way or in a blink of an eye can understand that you know the topic, you know the subject. So this can be better done when you are taking help of, or you are drawing diagrams.
Okay.
Wherever possible, some flow charts,
Okay.
tree diagrams or tables, comparison tables. In this way, when you write or represent your answer in such a way, examiner knows that you know the topic.
Yes.
Okay, but the standard way of writing any exam could be, you need to start with the introduction.
Okay.
Okay, you have made a diagnosis that this is this condition, or it is directly given in the question, you will start with introduction. Yes, after introduction, you need to write something about epidemiology of that condition. Okay, how frequently it is seen in this population, which age group it is seen, or anything like that. Then you can write about risk factors, etiopathogenesis. Okay, what are the risk factors, how does the disease begins, and what is actually pathogenesis.
Okay.
Yes, after that you can write clinical features. When we write clinical features, there are symptoms, there are signs.
Science.
If there are any named symptoms or named signs, any triads, that needs to be highlighted.
Okay.
Okay, written in capital or written in bold, underlined and highlighted, so that it is clearly visible to the examiner.
Okay, sir.
Yes, so after writing clinical features, next comes to the management. Okay,
Yes.
when it comes to management, we have investigations and we have treatment.
Yes, sir.
Okay, when it comes to investigations, first priority should be to the non-invasive investigations, which are usually the radiological investigations. Okay,
Okay.
or when we write such things, we need to write the classical clinical feature or radiological feature which is seen in this test. That needs to be highlighted. When we come to non-invasive test, what are the non-invasive tests? Okay, usually these are like FNSC or true cut biopsy, yeah, or any endoscopy or anything like that. So this could be the invasive investigations.
Yes.
Then we write the routine investigations. Routine investigations are like these investigations are needed either in diagnosis or for the surgery preparation.
Surgery.
Okay, these things can be written for all the questions, and this will give a edge to you. Okay, so here you can write some CVP, RFT, LFT, viral markers like HIV, HBs, AG. Yes, so RBS. These things can be applied to any paper, non-specific investigations. Yeah, so there are, when we write investigations, there are non-invasive, there are invasive and routine investigation. This could be the 3 sidedness we can use.
Okay, sir.
When we come to treatment part, we have the conservative surgery management and we have surgery.
Okay, sir.
Okay, so conservatively, how will you manage? If it's an emergency, how will you resuscitate the patient? Okay, if it's not an emergency, if the patient has some pain, some bleeding or anything, conservatively, how will you treat the patient first?
Okay.
Then what surgeries you would like to do? Okay, so properly defining the surgery, this surgery will be done, can be done in this following subheadings. So whenever you are mentioning about a surgery, okay, let's consider like you are mentioning about surgery for acute appendicitis.
Okay, sir.
Okay, so you can do it either laparoscopically or open.
Okay.
Let's consider open appendectomy. Okay, so in open appendectomy, you can write what is the indication for open appendectomy. You can write some indications for this appendectomy, why appendectomy is done.
Yes.
Yes, then are there any contraindications? Okay,
Okay.
in cases of appendicular mass, we usually avoid appendectomy. We go for conservative management, that is Auschner-Sherin regimen.
Yes, sir.
So that could be a contraindication for the surgery.
Yes.
Yes, then we can also mention like when to go for surgery even when it is appendicular mass or something, that can be elaborated. Then we have position for the surgery, in what position the surgery is done, whether the surgery is done in a supine position or the surgery is in a left lateral position or a Trendelenburg position. Okay, we can write the position of the patient.
Okay.
Then based on the surgery there is anesthesia.
Yes.
Okay, so what kind of anesthesia is used? Is it spinal anesthesia? Is it general anesthesia?
anesthesia.
Is it local
Local
anesthesia,
anesthesia.
regional anesthesia? Yes. Then we have named incisions. Okay, few procedures have incisions named after scientists or some famous people. Like in case of appendectomy, we have the gridiron incision or Mbbs incision. That again has some modifications. So we can write the named incision. Then briefly we can mention the steps of surgery. Okay, how actually surgery is done, how surgery is initiated, how structures are recognized, what actually is done with the structures, then how it is closed. Then most importantly, there are complications. So again, complications are immediate, early and late.
Okay. Yes.
Okay,
Yes.
so one or two immediate complications, like there could be some bleeding, or there could be injury to some structure, there could be injury to the cecum, there could be a bowel, or something
Yes,
like that.
yes.
Then there could be early complications, which could be wound infections or seroma formation. Then there could be late complications. Yes, so in this way we can write surgery, and when we write surgery, examiner actually knows that you know the surgery well.
Yes.
Okay.
Yes.
After that, in case of malignancies, after the treatment is completely done, you can also mention about prognosis.
Okay.
Once the treatment is done, what is the actual prognosis of the disease condition and how it is important to the patient.
Okay.
So to summarize, the presentation of the paper could be first starting with the introduction, where you write the definition. Yes.
Yes, sir.
Introduction. Then we come to epidemiology. Then we come to risk factors. Then etiopathogenesis.
Pathogenesis.
Then we come to clinical features, which includes symptoms,
Symptoms and
signs.
signs.
Then we have management part. We write investigations and treatment. In investigations, there are non-invasive, there are invasive, and non-specific.
Routine.
Non-specific or routine.
Routine, yes.
Then we have the treatment part. We have the conservative management, and we have the surgical management. Yeah.
Yes, yes.
In surgical management, we can write all the surgeries, and we can describe them in the side headings, like there is always indication, contraindication, position, anesthesia, incision, procedure, and complications.
Yes.
Then at the end, if possible, there is a prognosis.
Yes, sir.
Okay, and for conditions like in malignancy, we can also write about classification
Okay.
and staging.
Yes, sir.
Okay,
Yes, sir.
like how breast carcinoma is classified into two types, in non-invasive, invasive, then again lobular and ductal. Okay.
Yes.
Next, we can also write a TNM staging. Okay, so side headings matters, and then writing the relevant content matters. By the presentation itself, examiner knows that you know the topic.
Yes.
And presentation also gives a sense that you actually understood the topic as well. Like you cannot write like you start with the introduction, then immediately you write the surgery, then you cannot write pathogenesis.
Yes.
That is not the way of presenting. So it's better to write, to follow the same side headings and present the answer in a good way. And
Definitely.
wherever possible, take help of diagrams, flow charts,
Yes, sir.
comparison tables,
Okay.
tree diagrams.
Okay.
Okay.
Yes, sir. Thanks for watching. Hope this video was very helpful to you. ఈ వీడియో మీకు నచ్చినట్లయితే లైక్ చేయండి అండ్ షో యువర్ సపోర్ట్ బై సబ్స్క్రైబింగ్ అండ్ షేర్ టు యువర్ ఫ్రెండ్స్ ఆల్సో.